when you look at what we're doing to combat the opioid epidemic, you have to look at the people behind me, because they're the ones that got together and contacted our agency, asked us to start a task force, helped us with their, their position in the community to secure the important key stakeholders. We do have an opioid task force. We have representation from every hospital, every community organization that's addressing this issue, from prevention straight through to recovery supports, and we provide coordinated services. Prevention Links is proud to be the first organization to open a recovery high school in the state of New Jersey. We're really proud to be, I think, one of 2 or 3 communities that have a police initiative, CLEAR, that allows residents to walk into the police department and ask for help instead of incarceration. And we have a police force that responds to that with empathy and consideration, and they reach out to our office, and we send down peer recovery specialists, and we meet with those people, and we help them access treatment. And thanks to the work of Senator Menendez, we also have a federal grant funded through the CARA Act that is now allowing us to open a community recovery center, both here and in Roselle, that will provide comprehensive community-based recovery support services to help individuals who are returning to our community access meetings, all recovery meetings, smart recovery, 12 steps, also to resume their academic goals, their career goals, with support, with one-on-one support from recovery coaches. And we're also educating families and how to help set up the home so that they can be supportive, so our people can transition from early recovery into successful long-term recovery. So several years ago, I was lucky enough to be asked to join roundtable discussions. The leadership in Washington with Senator Menendez is unbelievable. I participated in 2 extensive discussions that were attended by individuals across sector, hospitals, law enforcement, community-based treatment. He really listened to what we had to say regarding how substance abuse affects communities, how it affects families, and how it affects individuals and schools and institutions. He listened, he took a lot of notes, and he took our word back to Washington, and he helped craft the CARA Act and other pieces of legislation that we now have seen come back to us in appropriate ways, so that we have the tools we need, both the legislation that really incorporated what we had to say at those meetings, and now he's fighting really hard to make sure that it gets fully funded.